Hello, and welcome to The Mind of a Therapist, a podcast where I interview psychotherapists and helping professionals on what they're passionate about in order to provide you with messages of encouragement and hope. I'm your host, Andrew Earl. The Mind of a Therapist is sponsored by Psychological Counseling Services, healing hearts and transforming lives. Look into our intensive at pcsintensive.com. In today's interview, I interview Jonathan Sabbagh. Jonathan is the co-founder and CEO of Journey Clinical, the leading telehealth platform expanding access to psychedelic-assisted psychotherapy. A serial entrepreneur, Jonathan built his career in finance, spending over 2 decades working for hedge funds and building businesses in Switzerland and New York. After receiving a difficult diagnosis of PTSD and extreme burnout, Jonathan left the world of finance to focus on his mental health, during which he personally experienced the transformative benefits of plant medicine and ketamine-assisted psychotherapy. Jonathan's personal healing journey inspired him to begin formal clinical psychology training at the New School with the vision of expanding access to transformative psychedelic-assisted therapies to the millions of Americans living with depression and anxiety. Ultimately, Jonathan's personal and professional journey motivated him to found Journey Clinical in 2020. The number one platform in the U.S. that enables licensed mental health professionals to deliver KAP at scale. Learn more at journeyclinical.com. So without further delay, here's my interview with Jonathan. All right, Jonathan, thanks for taking the time to be on the podcast. The first question I generally ask guests is, what's your take on change? And maybe specifically, since you're in the world of psychedelic-assisted therapy, like how do psychedelics assist people in the change process?
Yeah, that's an interesting question. My take on change is that it's the only constant and it's inevitable. I think that psychedelics are the first paradigm shift we've had in the past 50 years in the field of mental health. And so it's an extremely positive agent of change in that field. And, obviously we're excited about it. So I think that is the beginning of, being able to update a very outdated and old model that hasn't been able to solve the overall mental health crisis today. It's got some positives to it, but it's time for it to evolve.
Yeah, absolutely. And I'd love to hear a bit about your journey and how you got interested in psychedelic-assisted therapy. But before that, so it's my understanding you're not a therapist at this point, but I wanted to have you on the podcast because this is an exciting shift we're seeing with psychedelics, our culture kind of opening up to utilizing psychedelics in the treatment of PTSD and other mental health issues. And with that, from my understanding, and I will mention I'm new to learning about ketamine and psilocybin and their uses in realms of psychotherapy. But, for the listeners who are maybe in my boat, from what I've heard is from family members and close friends, it has been profound in helping them make shifts in their life in positive directions. And then at the same time, I've heard that there have been clinics perhaps that have been popping up. There's money going in this direction now, and with that comes organizations maybe who aren't providing the best services in terms of psychotherapy support and support before and after for people in these processes. So will you kind of, with these understandings first, am I right in saying this from your understandings being in the field of psychedelic-assisted therapy?
Yeah. I mean, there is a number of offerings that have come out over the years with ketamine, and maybe it's useful to frame a little bit what ketamine is as a compound and how it interacts and why these types of clinics have emerged. Ketamine is an FDA-approved dissociative anesthetic that's been approved since the 70s. It's one of the WHO's list of top 10 medications to have. It's very commonly used. In fact, emergency rooms have routinely used this to treat people with high degrees of suicidality. In the 90s, a gentleman called Evgeny Krupitsky started using ketamine to treat alcohol addiction. And so he developed a protocol which was then transferred over to the US by a person called Eli Kolp. And so that was the beginning of looking at ketamine as a means of treatment. And then over the past few years, it emerged that infusion centers and other clinics have started to administer ketamine for the treatment of anxiety and depression. And what happens with ketamine is that essentially it has, well, I don't know if you're familiar with the glutamate theory of depression.
Not too familiar.
So one theory is that essentially poor regulation of glutamates in the central nervous system is a physiological cause of depression. And so ketamine is an antagonist to the NMDA neuroreceptors, which are the neuroreceptors that receive the neurotransmitter glutamate. And so, when an antagonist means that it essentially behaves like a lock, and so it locks that neuroreceptor, and that causes reabsorption of the neurotransmitter glutamate, which helps regulate it. The other thing that ketamine does is that it increases neuroplasticity. So you know when someone's traumatized, for example, or highly stressed, there is a decrease in neuroplasticity because of the rumination of thoughts over the same idea over and over again. And so ketamine enables an increase of neuroplasticity and a window of about 7 days of neuroplasticity. So do other psychedelics. And so that creates the ability to create new learning pathways, right, or new neural pathways. And so the premise of some of the clinics that didn't integrate therapy, it's not that they were doing a bad job. It was that they were taking a very medicalized, or they are, some of them, taking a very medicalized approach to focus solely on the, NMDA antagonist properties of ketamine, which have been proven to substantially, reduce depression or suicidality scores very quickly in treatment-resistant populations. So that's a fact. And so what did start to happen, however, is that people started to have, psychedelic journeys while they were having these infusions. And so because that model really focused on the neurological effects of ketamine and basically was treating the dissociation as a side effect, they didn't take into account those occurrences. And so patients who had ego deaths or really profound psychedelic experiences in that context didn't quite know what to do with it. And so the need for integration of those experiences started to become apparent. And so in that context, what started to emerge is people started to look at ketamine as a psychedelic. And that means that the model of psychedelic-assisted psychotherapy, as MAPS or Compass Pathways or other organizations defines it, is, it's in the context of a therapeutic alliance. It's working with a therapist who is doing preparation, and preparation means working with a patient not simply to set intentions, but also to manage expectations on what that experience is going to be. So people do have transference to the medicine itself, and so people want to have a breakthrough experience, and so bringing people back to maybe simply being with the experience itself rather than wanting a specific result. So that's what preparation looks like, at least in the beginning. Having a dosing session with someone present who's holding space and who is facilitating that session with them, or in person or remotely, and then doing integration. And it's been found that, working to integrate these experiences is really what drives long-term behavioral change. And so I think that's the evolution from some of these clinics who are not really incorporating therapy to incorporating therapy within the context of ketamine-assisted psychotherapy or a broader psychedelic-assisted psychotherapy. And so that's definitely our ethos at Journey Clinical, is to support therapists to be able to deliver psychedelic-assisted psychotherapy in their practice.
Well, that's really helpful how you framed that for me. in terms of the neuroscience that exists. And in and of itself, it seems like this substance has really helpful utility in terms of treating depression. But I'm hearing if you can do preparatory work as well as having a psychotherapist there during the ketamine experience and then thereafter, that neuroplasticity allows folks to really make changes in the way that they are, because when people come to therapists, they're stuck, right? We're stuck in a way of thinking. Oftentimes it has roots in early painful traumatic experiences, and so it seems like a tool like ketamine can help consolidate change.
It can definitely help patients who are stuck. So a frequent feedback we have from our therapist is that I've had patients who were stuck for years, not managing to, overcome essentially their defenses. And maybe an important framing here is to understand what psychedelics, not just ketamine, do. Psychedelics are a defense lowering mechanism, right? They lower your defenses, which allows you then to have cathartic experiences that may not have been available prior. And so a lot of therapists that we've worked with said, oh, this is really amazing. My patient was stuck for years and finally in a few sessions, had very cathartic experiences.
I've been studying internal family systems these days, and Dr. Schwartz, he has a wealth of clinical experience, and then he started to treat folks with ketamine-assisted therapy, and in his language, the protective parts would just drop their guard, and people would have so much more self-energy, which in IFS is kind of this healing agent for both protective parts and exiles. And so, it seems like, and from all the folks that I've talked to have had experiences with psychedelics, they've talked about that.
I'm quite familiar with IFS. We actually have Sunny Strasberg, who works with Dick Schwartz, who does give a class and who does a peer consultation group for us regularly within our network. And so, IFS is a good modality to work with psychedelics. It definitely helps, like framing it in the context of the managers, the firefighters, and the exiles, and psychedelics do work in that way very well. So we like IFS in the context of CAP is more and more common and really a good approach.
Nice. And I'd love to hear a bit about your experience, Jonathan, that the experiences that led you to start this organization.
For sure. So, my background is in finance. I spent the first 20 years of my life working in various positions and building companies in finance. But about 10 years ago now, I suffered a very substantial burnout, which turned out to be the result of undiagnosed post-traumatic stress disorder. And I really spent most of my life depressed, struggling with substance abuse, and not really understanding what was going on. And that's a very ominous and terrifying thing to live with a condition that you don't quite understand. And finally, about 7 years or 8 years ago now, a friend of mine said, well, I was kind of at the end of my road there, said, why don't you try ayahuasca? And so he brought me to a traditional ayahuasca ceremony. And it was pretty amazing. I actually did 7 of them in 2 weeks after that. And it really changed my life. I then started working with ketamine-assisted psychotherapy with a therapist here in New York. And that was extremely transformative. It allowed me to live a much more integrative life. But it also prompted a career pivot. I no longer felt meaning or purpose. And I know this is a pretty common story in people working with psychedelics. But I wanted to do something that felt meaningful to me. And so I chose to quit finance at the age of 38. I actually didn't have a high school diploma, so I had to do my GED. And I went back to school here in New York at the New School to study clinical psychology. And while I was in school, I felt the need to bring together my background as an entrepreneur with my goal of becoming a clinician and supporting the delivery of these medicines responsibly at scale. And that's how I decided to found Journey along with my wife, who's my co-founder and who has her own healing journey, which I would let her share.
Great. And would curious if you're comfortable sharing a bit more about those experiences with ayahuasca and then ketamine alongside psychotherapy. When you look back at those experiences, do a few kind of leap out at you in terms of this was a big shift for me. This really, made a difference.
Yeah, many leap out. There were a lot of experiences that were very profound. Many were very difficult, and many were very beautiful. I think what I can, bring about is that the beginning of my work with ayahuasca was really, it saved my life. It's very corny to say this, but it's true. I was really on a downward spiral, and it allowed me to, I guess if we're using IFS language, or maybe some Jungian language, just really look at the shadow and understand the inner conflict that was within me, or at least have a view of it. But what did happen after a while was, and this is not everybody's experience, but it definitely was mine, was that I was finding myself unable to process these experiences. And so I was in a loop in ceremony, and I kept going back to the same experience over and over and over again, with and unable to really process it and move past it. And so at that moment, it became very apparent to me that I needed some help. It wasn't that the circle that I was working with wasn't capable of doing what they were doing, but this wasn't their job, right? This wasn't their scope of practice or understanding. And so I seeked out a therapist in New York, and then a psychiatrist that I now work with. And that was a big game changer for me. First of all, I got a diagnosis of PTSD, which was something I didn't even understand I had. And then by building, by incorporating that work within the context of our therapeutic alliance, that really sort of unlocked everything for me. It was really a moment when I had ongoing therapy with an analyst who I am still working with, who, I saw every week, but then we had regular CAP sessions where we were able to bring that material to that container and work with it in that context. And I really was able to, work on healing my PTSD, and it took some time, but so that was my experience with psychedelics.
And how nice to have that alliance with your therapist before the CAP session stands for ketamine assisted psychotherapy. Is that right?
That's correct.
Okay. Yeah. And to then have those sessions with this clinician who you have the rapport with, and then to be able to do the follow-ups, that's beats doing it with a stranger.
I mean, that's the whole ethos that we have at Journey Clinical, is essentially people shouldn't be handed off to someone they've never met or an app, or it should be within the context of the therapeutic alliance. That's how we feel, that's the safest container to us. That is the best way to deliver long-term behavioral changes. And honestly, you're having one of the most cathartic experiences of your life. And so that trust and that relationship really, we believe, allows for that to unfold in the best way possible.
And I think that would be a good segue into talking a bit more about what Journey Clinical offers for therapists, and then maybe we can shift to what Journey Clinical offers for clients.
Of course. So when we considered, what was the best way to support the mainstream adoption of these medicines, what we landed on was that empowering licensed mental health professionals to incorporate these treatments in their practice as an adjunctive therapy, very much like they would EMDR or any other treatment modality, was the most sustainable, scalable, but also safest way to do it, because of that therapeutic alliance that they have with their patients. And these are people who are also already embedded in local communities, and they have a relationship with the population. And so we started to consider what was the main barrier to entry for this to happen. And the number one barrier to entry, we surveyed 600 therapists, was forming and maintaining relationships with prescribing physicians. There's actually only 25,000 psychiatrists in America. They're mostly located in large cities. There's an equal shortage of psychiatric nurse practitioners. And so when those relationships exist, they're actually quite fickle and hard to maintain. But when they have them, it puts pressure on the cost for the patients, and it also limits the revenue potential for the therapist. And so what really happens for the most part is that these therapists tend to refer out to clinics like those that you were mentioning, or to direct-to-consumer offerings. And as we were saying, that's not an ideal patient experience, because you want to do this with someone you know. And then the other thing is also, we want these therapists to be able to build out their practices and have a flourishing practice, because having them have a flourishing practice is the best way to treat the 40 million people in therapy today. And so what it's important to understand is that what we're building at Journey Clinical, we're not an online ketamine clinic. We're essentially an infrastructure solution, right? What we're building is essentially the back-end infrastructure that will enable psychedelic-assisted psychotherapy to exist by empowering these licensed mental health professionals to incorporate these treatments in their practice and deliver it to their patients. And that's an important distinction. And so we are drug agnostic, right? But for psychedelic-assisted psychotherapy to exist, as MAPS or other organizations wanted to, this infrastructure is necessary. And so practically what that means is that we set them up with everything they need to incorporate ketamine-assisted psychotherapy. That's where we're starting, because that's what's FDA approved, in their practice. And that starts with a collaborative care model, which is in the form of a telehealth platform, where therapists become members of Journey Clinical. They refer their patients to our in-house medical team. So we are the doctor. We employ a 30-person medical team. And their patients are seen for a full hour intake. We will send them enough ketamine through sublingual ketamine to their home for 2 ketamine sessions. Those sessions can be delivered in a variety of modalities by their therapist. It can be at home, it can be in person, it can be remote, it can be group, it can be remote group or even retreat formats. We even do couples. So we're always evolving the modalities that we support, because it's important that therapists have the flexibility to deliver the modalities that are matching their practice. But also some patients may want to experience one modality and progress to another as their therapy evolves. And then they come back to us within a month for dose adjustments, and we see them regularly for follow-up consultations. The other part of that is that, I think the real power of our offering is the collaborative care model. And so we become essentially the therapist's in-house doctor. And so what that means is that we are there when there is a difficult experience that needs to be processed. They have 24/7 access to our medical team. We have a whole vigilance system. And that really mitigates negative outcomes, because patients go straight to their therapist. The therapist coordinate with our medical team, and we triangulate with the patient, and that really yields amazing results. But it also means that we're there to proactively collaborate with the therapist to deliver a bespoke treatment plan. Because our view is that there is no cookie cutter approach to this treatment. People do not do 6 ketamine treatments a month. They do not have a fixed treatment. What happens is that everybody has a different need at different moments in their life and therapy. And so we're here to collaborate closely with the therapist in a collaborative care context to deliver, essentially what is concierge mental health at scale. And all of this is supported by a tech platform where we have, a portal for our prescribers. We have a whole member portal. On that member portal, we deliver education. So we've got a 22 module CAP education program, which has been created by Fluence for us, which is available as part of the membership. We have a lot of peer consultation groups. We do a lot of programming, like Sunny doing webinars and expert-led consultation groups. There's experiential learning, where there's the opportunity for therapists to have a CAP session with other therapists in the Journey network. And then we support them with a library of resources, with marketing support, with legal offering. And all of this is HIPAA compliant. The platforms talk to each other so they can refer their patients through our portal. It's very easy. And then they can track their patient's progress. And then the patient have a portal as well. So to date, we have almost 800 therapists in our network. We've seen close to 2,000 patients in the past 11 months. And I was really amazed to see that through our network, therapists have delivered more than 3,500 CAP sessions to date to their patients. So it's been pretty awesome to build that out.
Wow. Well, it's so nice what you're doing, Jonathan, because it's
Thank you.
Working with folks. You're working with the therapist, coming alongside therapist as as they're practicing, right? Whatever model they use, IFS, narrative, solution, focus, EMDR, all of these, you can use ketamine as a tool to support the work, and especially for clients that there's just a lot of stuckness. And then the piece of collaborative care, it doesn't happen enough. Practitioners are just so stressed. There's only so much time in a day, and it's so important for all practitioners to be communicating, to be working together. And so I love what the need that you're filling is making that process easy within the frame of CAP. That's really nice.
Thank you. Yeah, thank you very much. Another part that's really interesting is that it's a big focus we have at Journey is community. And it's a large community of therapists, and they all connect with each other, and it's amazing. They meet up. We really support the whole community dynamic. And so, people forget that it's a lonely job, and having access to a network of peers who are doing this with them is really, really important. And so, our ethos at Journey Clinical is that if our therapists and our members do well, then our company does well. We have a virtuous cycle and a virtuous approach. So supporting their practice and having their practice flourish makes our business flourish. And so that's what we really are very happy about as baking that into our business model,
Oh,
rather than having an extractive one.
that's nice. And for clients, folks that are listening now that are interested in psychotherapy, maybe they have a therapist who they really are connecting with, and they're really interested in doing a CAP session. What's the process for them in terms of what Journey? Remind me of your company's name. Journey.
Journey Clinical.
You said it a few times. Journey
Yeah.
Clinical. Yeah,
Yeah.
in terms of what Journey Clinical provides.
For sure. So there's two ways that this can happen. If patients have a therapist that they're working with and they'd like their therapist to be able to deliver they can refer their therapist to Journey Clinical through our portal at journeyclinical.com. It's very easy. And that therapist can become a member of Journey and start to add ketamine-assisted psychotherapy to their practice and be trained by us. We have the whole program. It's all inclusive. Um, for patients who don't have a therapist but are interested in experiencing this modality in the format of working with a therapist who's CAP informed and a medical team that's psychedelically informed, they can log on, sign up on our portal, and we will match them with one of our 800 therapists.
Nice. And as I was perusing the website, it looks like there's a limited amount of states that you serve at this point. What is the reason legal, legislative, or what? I was curious about that.
Yeah. No, it's not legal. So ketamine is FDA approved in all 50 states. So the reason is simply administrative. We open up states gradually, but we are in all of the large states. So we're in California, we're in New York, we're in Texas, we're in Colorado, we're in Ohio, we're in New Jersey. We are in I'm forgetting a few. We're opening up Florida soon. So we're in many of the large states, and eventually we will be in all 50 states.
So we've had culturally there's kind of been a hesitancy around psychedelics in general, and being in this area, would you share a bit more about your understandings around this hesitancy, and then your understandings around why there's been more discussion as of recently with psychedelics?
Yeah. I mean, the reason why there's more discussion around psychedelics is that the number one healthcare crisis in the world today is not cancer, it's not obesity, it's mental health, right? 20% of the US population is suffering from some form of anxiety and depression. That's a tremendous amount of people, and it's getting worse. So there is a need, an urgent need to find new ways of treating this crisis, and psychedelics are definitely a very promising one. So that's why I believe they have come back to the forefront of the discussion. There's also been tremendous efforts from people like Rick Doblin and other organizations to, reinvigorate essentially what they call the psychedelic renaissance by, going through working with the DEA and basically bringing this into a medical model. And I think that's what has helped a lot of people being more comfortable with it. Is essentially, MDMA is now going through FDA approval. We're probably 2 years out from that happening. Psilocybin is going to follow suit. And there are, I don't know, like hundreds maybe of psychedelics being developed in drug development right now, and a lot of institutional money going towards supporting those efforts. And so that's very promising. It also shows that there is, a real need to find new solutions. So I think that's one of the reasons why, psychedelics have come back to the forefront. And then, the press, there's been demand from people and very positive news from the press to show that these are interesting treatments. They're now, it's now frequent that everybody talks about microdosing and saw, how to change your mind. And so it became a more acceptable conversation. Even, when my parents talk about psychedelics, they're like, oh, wow, this is actually something. So it was an interesting conversation to
Yeah,
bring up to
how
them.
have they responded to your line of work?
Well, it was weird for them. My parents are Sephardic Jews, and when I told them, "Hey, I'm going to quit finance and go back to school to study psychology," that was an interesting conversation.
Sure.
And eventually, I think what happened is that they saw how much I benefited from these treatments and how well and happy I am in my life, and that really encouraged them to support that. And then they saw that we built a company that's helping thousands of people and growing by the hundreds every week. And so, of course, they're super supportive and really amazing. But it was definitely not the first thing that they thought of. They're like, "What, ketamine?"
That's yeah. With what you're saying is when people have intimate relationships with folks, and those folks experience healing, that's profound. I think that's a part of what you're sharing with that shift too. Is when you have a family member who's really struggling, and then they do cap sessions with psychotherapy, and that you see these profound shifts in them. It changes your preconceived notions about what that something is.
100%. And I think that bringing this to psychotherapists who are talking about it with their patients, so they're the ones bringing it up, at least in our model, that's the way it works for the most part. It changes a little bit of the dynamic where you're here with someone that you trust in a therapeutic alliance, in a therapeutic modality and setting. And so this is someone telling you, well, maybe this is something you could benefit as a treatment modality. And so, I'm very blessed that I benefited and still do from indigenous approaches and culture and groups who deliver this amazing work with ayahuasca. But not everybody is willing to go to the jungle and have that experience. And so we live in a Western medicine model. This is our reality and our civilization. And so, within that model, that's the language that people understand. And so I as much as I think preserving and supporting these indigenous communities is essential because they are the root of all of this work. bringing it to the medical model as well is, the only way we're going to get real adoption. And so I think that that conversation and that approach to talking to, someone who might be 60 or 70 years old, who's traumatized and who's maybe open to working with this because they haven't been able to get past some early life trauma, it might be a little bit daunting for them to do that in another setting. And so I think that's helping a lot. And so the medical model and the medical approach, I think, really is helping propel this to the forefront.
That's good. And you were saying there, honoring and learning from and respecting, the indigenous cultures that a lot of these plant medicines have been used throughout time. Would you say more of like how, psychotherapists and the medical community who are using these tools can honor those traditional uses of these medicines?
Yeah, I mean, there's so much to learn from those groups and modalities, maybe from music or holding space or working with difficult experiences. And so there's a transfer of knowledge, I think, that's happening, and where they incorporate it as part of their practice. There are people who do amazing work out there, this Shakruna and all those people who work with supporting those communities, and they also are clinicians. And so I think there's an ability to have a transfer of knowledge. We definitely encourage that through our network. But this is a medical model, and I think that's important to keep in mind. And so not everybody is going to respond to those dynamics, but there is music, there is the ability to hold space. It's quite wonderful. Yeah.
Nice. And so you actually went to the jungle then and had ayahuasca experiences?
I didn't go to the jungle. I did it here in New York.
Oh, you did here. Okay. Nice. Um, let's see. Let's see if I reference my notes, see if I have any other questions for you that I haven't touched on. Yeah, so earlier, I just want to track back to this idea of earlier you're saying, it's when you hear about these experiences people have with psychedelic assisted therapies, they seem like this panacea, right? This quick fix, which our society loves. But from what I'm hearing you say, you view it as more of a tool to be used within psychotherapy. I know you touched on that a bit, but could you speak on that a bit more?
Yeah, I think that's a very important question. Psychedelics, like any type of treatment, are not a panacea. It does not exist. It's all work, right? I do yoga and I meditate and I have therapy and there's a lot of things that make it work. And so I think these are tools. These are tools that are very adapted to be used in the context of a therapeutic alliance with a therapist under medical supervision of a medical team that understands how to prescribe them and understands interactions with other drugs. And so that's really important to understand that, this is not necessarily a quick fix. It's also not necessarily for everyone. And so having an informed practice, our medical team is, very well versed and trained into assessing eligibility. And, we're not here to just prescribe ketamine. We're here to support a collaborative care model, support the therapist in their practice, and get people better. And that doesn't always mean prescribing to them.
Yeah, and I just want to echo this idea of it's for all of us, for those therapists who are listening, clients that are listening. It's psychotherapy is a tool. The models psychotherapists use, psychedelic assisted therapy, a tool, and these tools they can have profound effects on our lives. But the rubber hits the road on the day to day, right? On our practices throughout the day, how we are engaging with ourselves and others on a day to day basis, and I don't think that there's very clear right or wrong ways of what self-care looks like what a healing journey looks like. But I'm so drawn to this idea because I just think, being completely honest with myself and, anyone who I get to know intimately, it's a lifelong journey of healing. There's not an end. As much as I wish there would be at times in those dark moments, making yourself available to that intensity and being with yourself and connecting with loved ones as much as possible. Like that's the practice. And yeah, so I just wanted to echo that sentiment
Yeah,
there.
I could not agree more. And that's why it's so important to have integration with a therapist who's informed in this process, right? That is where long-term behavioral change happens. It's been proven and documented and researched. And so really that's why we operate the way we do. That's what we facilitate essentially, right? We're facilitating the ability for the therapist to work with the patient. The dosing session is the dosing session, but the real work happens after, when they're integrating these experiences and working with them, and then for the patient then to bring them into their life. So I could not agree more. It's a lifelong journey for sure.
Nice. Well, Jonathan, what have you been learning these days? Like, what's been piquing your interest personally, professionally? What's been exciting you?
Yeah, I mean, it's been, running a startup is an interesting journey. It's very psychedelic.
Yeah.
It's a very intense process, and this is my work. I'm very honored to be steward of so many people and building an impactful business. So that is what my passion is today. And so much comes up when I do this work. I think my latest learning or my latest work is that there is always something going on. Like there is always a giant problem that comes up, and developing coping skills and mental flexibility and essentially leaning into constant change, that this is my reality, which is, I think it's everybody's reality. But in this context, I've been given the opportunity and chance to be able to observe it very intensely. And so, everything comes out. And so being able to be present with that work, with that change, with those dynamics, and learning how to flow with that, I think this is what's interesting me now. And this is my work today.
Well, that's coming full circle then. That's what you
Yeah.
mentioned at the beginning is the constant changes we deal with, and I can only imagine as a entrepreneur of a business, that's growing as quickly as yours, there's a lot of flexibility that's required, and that's good.
Yeah.
Well,
But it's fun
mhm.
also.
Oh, absolutely.
Yeah.
That's what it's about too. Having
Yeah.
having the fun and the
Yeah.
lighthearted moments
Yeah.
amidst all
Yeah.
the fires.
It is. And also just with so many amazing therapists, like we have hundreds of people who do amazing work every day. I'm so lucky and blessed to work with them. We have a weekly open house where we talk to where we just make ourselves available to our members. And it's always my favorite time of the week. Every week I get a chance to speak with them and hear their stories and what's working or what's not working, and learning from them. And there's so much to learn, and they're so amazing. And the work that they do, I have so much respect for all this community that spends hours every day holding all of that for their patients. And so giving them support, that's a really it's a huge reward for me, and I know it is for my team as well.
Mm. And so for all of our therapists who are listening, thank you sincerely. The work you do is hard, and holding the space for people to talk about some of the most painful and then joyful moments of their lives, the directions they're having, the most intimate difficulties that they have. It's intense work, but it's such a gift and has such ramifications. So I know it's difficult, and if you're out there listening, thank you.
Yeah, and the other thing is that the solution to the mental health crisis is you, the therapist. You are the answer. That's it. You are the vehicle of change, and you are the cure. And so we're here to support you. And that's right. That's why we do what we do.
That's so great. Well, Jonathan, we're nearing the end of the interview here. Is there anything we didn't touch on that you wanted to make sure to mention before we wrap up?
No, I think that we're just grateful to doing this work every day. That it's very inspiring. We're so excited about bringing about change in the world and supporting agents of change that are the therapists, and supporting all these people who who are in need of a new modality to help them progress past the suffering. And so, I can only just express tremendous amount of gratitude and humility in doing this work.
Awesome. Well, I've certainly been excited throughout this conversation and learning more about the work you're doing. And I think it is really filling a need that has emerged within this space. So thanks for all the hard work you do. And before I ask you the last question, I ask guests, where can folks find you? Where do you want to direct people who are interested in your work?
Sure. So they can find us at journeyclinical.com, and all the information is there.
Perfect. And then the last question I like to ask guests is, what's a message of hope you'd like to leave the listeners with today?
I can lead the listeners with a message of hope, which has been my personal journey. And I think it's been really the most beautiful realization that I've had in my life. It's that we have this notion that we need to change to be better. I think this is something that exists in our lives every day, in our society. It's been really, put in our brains since we're our youngest years. And the result of most of this work is that I'm already perfect. And I think that, remembering that and being loving and kind to ourselves, and that it's already there, we just have to remember. I think that is the most beautiful message of hope that I could deliver, because it's been my most beautiful message of hope.
Well, it's beautiful to meet Jonathan. That's very touching. Well, thanks.
Thank you.
Thanks so much for being on the podcast today, Jonathan. It's been a pleasure talking with you.
Likewise. Thanks for having me.
Please press the subscribe button, as well as rating and reviewing our podcast. This helps others connect with what you've been hearing. If you have any questions, please contact us at themindofatherapist@gmail.com. These questions will be kept anonymous. I want to thank Eric Price for the wonderful music you hear in this podcast. Additionally, this podcast was created to provide accurate and authoritative information on the subject matter. Although we are interviewing licensed therapists, they are not your therapists. This podcast is not intended to serve as direct medical advice and should not be used as a substitute for direct professional help. It is given with the understanding that neither the host, publisher, guests, or PCS are rendering legal, clinical, or other professional information. If you need a professional, we encourage you to find one. Visit Psychology Today to connect with a licensed clinician near you.